All right, I guess we'll get started. I know more people are coming. They'll join as they log on though. Okay, so everyone, thank you for joining us this afternoon. If you can scan that QR code to sign in, that'd be great. Attendance is needed whether you claim CME credit or not. So just take a chance and scan that when you can. Also, just want to thank you all for muting your microphone once the presentation begins, being attentive to the presenter and engaging the session, and also completing and submitting the session eval form. And I'll put that eval form in the chat. So whenever you get a chance, just complete that as well, okay? Next slide, please. So this is the South Texas Regional Family Medicine Grand Rounds. Next slide, please. So here's the activity code for today. So I'll leave this up here for a little bit so you all can get that code and get your CME credit. All right, next slide, please. And this is just more information about getting that CME credit via text. If you just read that info, and that is the activity code again as well. So I'll leave this here for a little bit for y'all to take care of that. All right, next slide, please. So this is just information regarding CME transcripts. So I'll leave this here for a little bit for y'all to read. All right, next slide, please. And this is just information regarding the AAFP credit system. All right, next slide, please. And this is also information just regarding the core competencies. All right, next slide, please. Okay, and the conflict of interest statement. So Dr. Kornsawad has no financial relationships with the ineligible companies to disclose. Next slide, please. All right.
Can I start?
Yes, sorry.
No worry. So good afternoon, everyone. Thank you so much for having me here today. I'm Kanapa Kornsawad. I'm one of the faculty in the Department of Medicine, and very thankful for the invitation to do a grand rounds for family medicine grand rounds today. So today's topic, let me go back real quick. It's the emerging field of coaching to improve physician well-being and decrease burnout. So let's start with 3 objectives I have today. First, understand burnout and professional well-being and the impacts on the healthcare system. Second will be define the definition of coaching and its use in medical education. And last will be identify the benefits of coaching and burnout and professional well-being. So when I first started preparing for the presentation, I was reading on how they do present grand rounds in the past because they don't have PowerPoint. And I have found that they presented with a real patient being in the auditorium. So folks will ask questions and they do some physical exam. And after the patient left and everyone discussed the case. So I want to start my grand rounds with a case study. This is a mid-career woman feeling overwhelmed and stressed with her career path. She feels like an imposter, which leads to declining opportunities and challenges. When she walks into the institution, this is her thought: all these people really seem to have it together, and I still have no idea what's going on. That's not only one thought that she has, there are other multiple thoughts. I just got lucky. Failure is not an option. I cannot fail. I don't belong here. Sometimes she feels that way. All of these thoughts may not causing her burnout, but it has affect her professional well-being. I'm sure you heard about imposter syndrome. She definitely meet all the criteria. We do the young imposter scale. Not until she got an opportunity to learn about coaching, which actually has improved her professional well-being and her view about her works. So let's look at burnout and professional well-being definition. So I'm sure all of us already heard a lot about the definition, and you know by now that is a syndrome conceptualized as resulting from chronic workplace stress that hasn't been successfully managed. There are three components of burnout: emotional exhaustion, depersonalization, reduced personal accomplishment. And what about professional well-being? Is a job related and generally a function of job satisfaction to finding meaning in your work, feeling engaged and fulfilled, and having a high quality working life. So this picture, just want to share with you all about the factors that would impact how clinician burnout and professional well-being, and we look at the outcomes here. So if you're looking at the gray, the outside big circle here, that's what the external environment. That's at the level of the policies level. The regulatory factors, even when you hear they announce some news, it's actually affect how you feel in that day about our healthcare. And if you're looking at in the middle, it's a healthcare organization. It's talking about organization culture, the benefits as a physician or healthcare providers, any leadership style that we experience. And if you're looking inside, it's our like almost day to day, our patient encounter. Some days it can be challenging, our administrative burden, and anything that related to healthcare, you have to discharge patients, the inbox that you have to answer. Sometimes we think about poorly designed technology, some moral distress when we try to advocate for patients and it did not go well. Our like all ism, right? Gender inequity, any racism in the system. And that is also work that we call work system factors. Then we also have our individual mediating factors, our beliefs, our responsibilities from home, our trade, especially a lot of physicians, we know that we are perfectionism, and that actually related with burnout and how we coping our strategies to cope things. And that affect the outcomes with our well-being, with the burnout, and the consequences is not just us that affect this, it affect our patient care, how medical errors happen when you get burnt out, when you don't feel well. It affects our overall healthcare organizations, and it affects society. So all of these will help us learning about them and improve them will help hopefully with the burnout and well-being. So just want to share some information about this. I think it's very interesting because they said by 2034, we will be having primary care shortages between 17,800 and 48,000. And if you want to think about the numbers will be pretty much right now in Texas, in the state of Texas, I just try to Google and look at the data. We have about 22,000 of primary care physicians registered in Texas. So by 2034, we might have a lot of primary care shortages about the size of the Texas. So let's look at this. I think this picture is very reflect how evolution of the physician well-being very well. And also it will relate it to our coaching toward the end. So what is this thing? This is the picture we call the first one is the era of distress. This is the historically with the phase of lack of awareness, right? The people that working the workforces during that time will be mostly men. There's no limits on work. You just keep working You just take care of yourself, do self-care. That's your job. You have to be perfect. So then we start to looking at more of like well-being 1.0. When we start to be aware of, maybe we can't just keep doing that. This is, we just think about our qualities as hero-like qualities. We start talking about wellness. We start talking about work-life balance. We have to be more resilient. We start connecting with each other. We kind of share stories. We start to feel that. But also our healthcare delivery system change. You have a lot more EMR responsibility. You have to do billing. Our productivity linked to a lot of things. You feel frustrated. And the frustration is toward the system. You feel frustrated, and our administrative might be frustrated with us. We feel frustrated with them. This is what we call awareness. We are aware of that situation and look at the trees from the falling leaves, brown, then we start having a little bit better on green. But where are we going? This is what we want. We want to go to well-being 2.0, which when we call the action, we think about us as human qualities. We're all vulnerable, but we have to have growth mindset as well. Maybe work-life cannot be balanced. We can't segmentalize them because that actually cognitive drain at us. But maybe it can be work-life integration. How we can actually maintain this healthy between the work and life and have it coexist peacefully. We have to have self-compassion and we have to have community. We can't just be in administrative against us, we against them. And also it's very important for us to actually finding what meaning and purpose in our work. So I just want to pause a little bit and share this picture of the art. This is it's titled Woven and by Tia Coward. She talked about this picture as, if you're looking at this, woven represents the intricacies, layers, and complexities of feeling burnout while you're serving your patients. It doesn't happen all at once. It's just built over time. And if you're looking at the shimmering threads, it represents life and hope that is embedded in each provider, the spirit of serving, and the belief that you will make a difference. So I love this picture. Next, I want to just take a little break before we go to the intervention. I want to ask everyone here, what interventions have you witnessed that effectively promote your well-being and decrease burnout? If you can share your thoughts in the chat, that would be great. If you can, if you're not driving, you can share, you can type. That would be awesome to see what strategy we have been doing, intervention that we have been doing. I see reflection. That's one thing that popped up in the chat. Any other things that you feel like, it's actually working? I'm sure we do a lot of other things, right? Yeah. Besides that reflection, you do take care of physical health. Of course, that's very important. Sleep, I love that. Yes. An ability to share experience with compassionate colleague, debriefing, time with your family and loved ones. So that's all excellence. This is all something that we have been doing, try to do, and we'll look at literature. Thank you so much for all sharing and getting recognized for my effort. Definitely. Okay. So let's look at what is in the literature then. So this is the study published in 2016. They're looking at interventions to prevent and reduce physician burnout. It's a systematic review and meta-analysis. So they're looking at about 2,000 articles, and they found 15 randomized control trial, 37 observational studies that met the criteria, and they just summarized and looking at that. So what are the results then? So most studies reported on changes in burnout domain scores. We talk about burnout has three main things will be emotional exhaustion, depersonalization, and also professional accomplishment. So most studies actually showed change in those two domain scores, but there were 5 RCT and 9 cohort studies that reported decreased overall burnout with all 3. So, but when they're looking at it, they said, organizational one is actually affect more than the individual factor. However, so both individual focus and organization intervention can reduce physician burnout. It may have different effect. So then when we're looking at it, you just notice that because it's so complex, right? And even all of these studies, when they're looking at the adverse effects, when we try to actually implement something, the study show that it has adverse effect. And what they did, actually, they looking at the organization at the system level, they decreased faculty coverage from 4 weeks to 2 weeks. And they found that the decreased perceived ability by residents and medical students of attendings to fairly assess trainees and decreased summary assessments of attendings by medical students. So there's some adverse effects that report, but none of the study looking at both intervention together. So further research is needed to establish which interventions are most effective in specific populations, or maybe we need it all. So what interventions that they're looking at? I just looked at another study in 2018, and it's pretty much similar what intervention that they did in both the systematic review. So the individual focus, a lot of you kind of mentioned about that, right? Like cognitive behavioral therapy, you have mindfulness-based stress reduction techniques, you have educational programs in terms of stress management, you talk about sleep, you talk about share story with someone, a compassionate of your colleague. And what about at organization intervention that we talk about? We talk about schedule assistant, some changing in workflow, decreased workload, improve communications among consultants. You know that that affect your well-being when you're working very well with each subspecialties. And last, I just want to point like using AI. There's some talk about using AI to perform certain tasks for us in the future, because we can't deny that AI is going to come, how we can use that to actually help us and not replace us. What about coaching? This is what I put coaching. It's kind of put it on the individual focus, but still have overlap. I really want to do this because it's kind of overlap to organizational intervention. What is that then? Because coaching is the process that want you to empower you and be the best version of who you are. So coaching definitely is individual focused and also is individualized because each one of us have different roles, responsibilities, challenge, and experience. Sometimes other individual focus might not really tailor to that, but coaching actually tailored to all the details. And when you feel empowered, you might be so clear and you know exactly what you want. You know what the next step you might want to take to make changes to the system level. Instead of coming from the resentful, you're coming from like empower. So I put coaching in between because I think it can affect both. So next question. I want to see what is one word that comes up when you think about coaching. I would love to see some chat as well. If you can share with me, that would be great. Yeah, what is one word? I see a few words: mentoring, guidance, encouragement, personalized mentoring. Yeah, a lot of us talk about mentor, right? Guidance. That's great. Let's see what coaching in the literature means. I'm surprised. One word I haven't seen it here, but I will share with you. So, what is coaching? So, coaching is a comfortable bus to transfer you from one place to another place. So that's what coaching in the dictionary. But I was looking for this. I was looking for someone to say, oh, coaching, that's Ted Lasso. I'm not sure if any of you watch Ted Lasso. It's a really funny show. I love this show. And Ted is one of the coach that train soccer players in England. He's an American, but he doesn't know anything much about soccer. So it's pretty funny show, but also inspiration. I'm sure a lot of you, maybe some of you here watch Ted Lasso. So coaching is a process that helps people achieve positive, sustainable change and growth. And why I kind of highlight sustainable, because we want change to be sustained. We don't want just one-time thing. You change for today, and then you go back to where you were the next day. So coaching also meaning unlocking a person's potential to maximize their own performance, be the best version of you are. It is helping them to learn instead of teaching them. And for Ted, this is what I like. For me, success is not about the wins and losses. It's about helping these young fellas be the best versions of themselves on and off the field. And it isn't always easy, but neither is growing up without someone believing in you, even yourself, right? So this is something that I think it hits a few important point about coaching. So let's look at coaching history. I was surprised that no one says sport when you think about coaching. So coaching started way back in sports, and that's the picture. Then it started coming to other industrial. This is like entertainment. You have singers, actors, actresses. They have coach. You will see this is like the picture I've tried to put it is like C-suite. You sit in C-suite. You have executive coach, coaching for business. And in this area, you will see a lot. We have coaching for self-improvement. We have coaching for weight loss. And we do have coaching in our medical education. So what is coaching in medical education? This is a free faculty handbook. Actually, you can download it for free from AMA. It's coaching for mostly they focus on UMA level, but they also have a chapter about GME. So you can use coaching in academic performance, competency development, career progression, professional identity, and reflective practice, and of course, well-being that we are going to talk about. So when you're looking at medical educator, we have so many hats and what hats that we're wearing. So if you're a teacher, I just want to kind of, because we talk a lot in the chat, we talk about mentor, right? So if you're a teacher, what you do, you direct, instruct, you give them feedback. You also be a friend too. You let them vent. You can offer you advice and personal perspective. You are a mentor. A lot of us talk about mentor. When you mentor, you actually give them wisdom. You have experience before, you talk to them, give them wisdom. And you can be evaluator. You have to assess our learners. We rank and rate them. We also advisor, right? We advise them, give them your advice and recommendations. We are sponsor. We give them help, market them, and we advocate for them as well. What about coach? So when you coach, meaning that you help guides coachee to find their own wisdom, and that's what coach does. Well, I will share example at the in the middle of the presentation so you can understand. It's slightly different. Coaching and mentoring can be overlapped, but it's slightly different. So this is Dr. Atul Gawande. He is a surgeon, a writer, public health researcher. Some of you might have read his books, which I really like a lot of his books actually. This is his quote after he asked another surgeon to observe him while he was doing operation and coach him afterwards. He said, coaching done well may be the most effective intervention designed for human performance. So that's what coaching for the clinical performance that they use. Now we're gonna dive into coaching and well-being. So if you see ACGME residency milestones, This is the different one. This is the ACGME clinical educator milestones. Before we start looking at the literature for coaching in physician well-being, I just want to share this because came out in August last year. This is a kind of helpful self-assessment tool in well-being that ACGME used for clinical educator milestones. So it's very important because well-being is actually part of the universal pillar for clinical educator. What you can use, you don't use have someone evaluate you. You can evaluate yourself, assess yourself where you are at in terms of well-being. This is one of the competency. And when you're looking at sub-competency, this is the well-being of learners and colleagues. So it seems like we also have to guide others as well, both learners and colleagues. So that's why well-being is very important as part of our job if you're as an educator. So coaching in burnout and physician well-being, we kind of talk about intervention both at individual level and system level. And those of most of the intervention existing focus on specific stressors, right? If you work long hours, maybe we cut down your hours. Of course, that's great, but there's so many factors that play a role when you become burnt out or it affect your professional well-being. So this is the result of the study looking at the impact of coaching, and they can only do a systematic review, but not meta-analysis because of the heterogeneity of each studies. They're looking at about 200 studies, and they find that across all studies, total 14 studies meet the criteria, and that roughly 1,000 physicians. In 14 studies, 5 randomized controlled trial, they found have low risk of bias. They found non-RCT before and after, and mixed method for coaching and well-being and burnout. So the result for this show that coaching have improved outcomes related to wellness. It can decrease emotional exhaustion, distress, and burnout. Of course, there are limitations for this because it's no standardized reporting or outcome measure. You don't really know what is the minimally effective dose for coaching. So I'm going to pick out 2 studies from this systematic review. So the first one is looking at a professional coaching intervention on the well-being and distress of physicians. This is a pilot randomized controlled trial. They enroll 88 volunteer physicians and do a 2 group. The themes during the discuss will be about, actually this is the theme that came up, is optimizing meaning in work, how to integrating work life. This is a one-on-one coaching over the phone, and they do it about 6 coaching sessions. The results show that it's actually a significant reduction in emotional exhaustion and overall symptoms of burnout. And it also improvements in overall quality of life and resilience. The study actually has some concerns from the Cochrane bias in terms of the measurement of the results, but that's just from the systematic review. So then I pull another, this is the first one, and I pull out from that. So I looking at another one. The reason that I pull this one because it's kind of unique, and we are actually, our UT Health San Antonio is part of the study, not the pilot study, but the randomized control trial, the second part that I will talk about it. So this is the randomized control trial. They're looking at female trainees. And the reason that they talk about female trainees because they said female trainees are disproportionately affected by burnout due to some micro and macro aggressions and social pressure to take on as a parent and take care of their children. So they're looking at 101 women at University of Colorado, and they do randomized control to 2 groups. They do group coaching. This is something that is different. The first one is one-on-one. This one is group coaching. It's an online group coaching. They also have some other YouTube short video for the residents to watch at their own time, and they also can coach through email. So this is what they did. Primary outcome, they're looking at burnout, right? So they're looking at emotional exhaustion scores. If you're looking at the coaching group, is actually significantly dropped the emotional exhaustion score drop compared to the control. And they also looking at the secondary endpoint, which is young imposter score and self-compassion scale. They found out that self-compassion scale is actually higher. And why it's important? Because self-compassion scale is actually associated with decreased symptoms of burnout. The higher is the better. And young imposter score is lower in people that get coached in this study. And if you're interested to know what they are, this is just because we are working with them. We are one of the site participation site. So you can scan this QR code. You can take a look to see what they have to offer. And this is the study that they did last year. The impact is not yet published, but they allow us to share because we're one of the site. It's the impact of an online group coaching program to reduce burnout in female physician trainees. It's a multi-site randomized control trial. So this is way bigger than the first one. The first one is the pilot. So they be able to do total of 26 GME institutions in 19 states. And the 1,017 female residents register for this. And we have our residents and fellows as well. So what are they looking at? The primary outcomes. The result is the intervention to looking at the burnout scores. And they found that it's significantly improved compared to the control in all MBI subscales. We talk about emotional exhaustion, depersonalization, and personal accomplishment. And when they're looking at the secondary outcomes, they also found that the imposter syndrome is improving, self-compassion is improving, moral injury is dropping, and flourishing scale, which is another well-being score, actually better in this group. So why is it important? Because another study, if you're looking at why emotional exhaustion score is so important, why do you want to drop it? Because if you have 1 point increase in emotional exhaustion, it's actually associated with 7% increase in suicidal ideation and 5% increase in self-report major medical errors. So this is the study that we participate in. So let's look at coaching. What is it? What is the foundation tenets of coaching? Like how does it work, right? So coaching, it's the one that being coached. They bring the problem and where they want to go and the destination. And we believe as a coach, we believe that they has the best answer for themselves. The one that know yourself the most would be yourself. And I don't know how to say it correctly, but everyone, we know ourselves the best. So coach, what is coach doing then? They facilitate awareness, vision, and desired outcomes. They review impediments to progress. Anything that would prevent that would be like perfectionism. We talk a little bit about it. Fixed mindset. They ask questions to help show the coachee their thinking. A lot of active listening going through during the session as well. You listen not to judge that person. You listen as a curiosity. And you separate facts from story. You will, I will explain later because we always tell everything just sounds like a fact, but maybe we are using our thought and that's all the whole story. So coaching rules of thumb. Coaching is definitely not counseling. If you have depression, if you are having anxiety, this might not be a great option for you. Can you have both? Yes, you can have counselor and you can have coach, but if you definitely have depression or anxiety and you have other diagnoses, then coaching might not be the best option for you. It's not a counseling. And coaching offers a way forward that embraces the circumstance with empowerment. I mentioned a little bit earlier, right? Like if you're coming from the empowerment, you've being clear, you know what you need, you know, sometimes you can think better in terms of like, where should I go from here at my capacity? What things that I can change? Because sometimes you cannot change who you want to work with in the moment, but how can you change other things? the goal in coaching is not always to feel better. You don't go into the coaching and just like, okay, I'm going to feel great after we finish that. That is not the case, because I'm sure you heard about toxic positivity. You don't have to feel good when things are not going well. And it's okay to feel sad, mad, and frustrated with the situation. But if you think that, oh yeah, it's fine, everything is fine, then it can cause the reverse effect, what we call toxic positivity. So this is a picture of my dog. She's very happy. She feels happy when she gets to be outside in the sun running at the pool. And it's okay for her to be sad. Can't go outside. It's raining today. It's storming right now. So it's okay to process and understand that situation can cause certain feeling, but it's also up to you. How do you want to interpret it and how do you want to process it? So I'm going to go to the next two case studies. The first one is a case study of a practicing physician. This is Dr. Greenlee, 54, well-respected PCP. Recently, he became short-tempered with staff, persistently late with paperwork, exhausted and emotional distant. He dwelling on negative aspect of his personality. He feels like an imposter and disconnect from earlier sense of purpose. If it's hard for you to read, I just want to share how they go through the process of coaching. So Dr. Greenlee's issues, cynicism, decreased sense of purpose. He said, I'm like a hamster on a wheel, why go on? So coach just asked, what gives your work value and meaning? He responds, my relationships with patients have always been what is meaningful for me. And the result is we actually able to existing sources of professional meaning and highlight that. So sometimes going through your day, you might not even looking at this, like what is actually give your work value and meaning? Maybe we forget about it. And the other things is, I'm like what energized you then? So Dr. Glenn said, playing piano brought me peace. And the coach just asked if he thinks that he can put that in his schedule so he can feel having control over his schedule. So that's the case study for practicing physician. Now this is a case study of a learner. This is story. When I was on wards and my patient needed an LP, the upper level resident asked if I want to do it, but I was so clumsy the last 3 I tried, and I was scared to hurt the patient or look incompetent. I made up an excuse and handed it off to my co-intern. Maybe I'm just not a procedure person, and I should consider non-procedure specialties. Maybe some of you here have that feeling before. Maybe some of you may label yourself like that before. So how would you approach this, right? Of course, we have multiple hats. I mentioned about it. As a friend, you might say, oh no, that sucks. The other day, I did the same thing with the central line. If you're a mentor, you might say, oh, missing an LP doesn't mean you can't be a critical care. Let me tell you how I got here. Because you have a wisdom, you have experience. And what about advisor? I think you should go to the sim lab and practice until you feel confident. So we see that all the time, right? So let's see how as a coach approach this. So I was on wards with all the same story. Coach, just be curious. Tell me about clumsy. And this is what it meant, the resident perspective of clumsy. It was my first time, it was her first time. I attempted twice, and my resident got it on the first attempt. The second time, patient was obese. I tried 2 times and had to change to longer needle and got in the third attempt. The third time, there was blood tinge mixed with the CSF, and patient complained about headache post-procedure. This is her perspective of clumsy. I'm sure some of you might be like, maybe that's not really clumsy, maybe, right? And her thoughts about this. Asking for help, equal to incompetent. Complication means she did it wrong. Other people got it on the first pass, and she should too. So that's her thought. We talk a lot about growth mindset. I show you the picture of the trees and how we progress to well-being 2.0. Growth mindset is one of them. Someone told me failure is the limit of my abilities. That's what she kind of labeled thinking about that. But someone told me fail equal to first attempt in learning, which I love that. Instead of failure is an opportunity to grow. That's the growth mindset. She just think failure is the limit of my abilities. I'm not a procedure person. I can't do this. Either I'm good or I'm not, right? And sometimes it happens to us a lot. Like for me, I personally have that. Feedback is constructive if you have growth mindset. But sometimes when I get feedback and criticism, I take it personal. It's just like either I'm not so good or the person that eval me is so unfair. That's what I had before. So what other things in this case that we identify? We identify the other impediment, which is perfectionism. If you heard about this, I heard about it. A equal to average, B below average. Only A plus will be okay. So this is what from Brené Brown. I'm sure a lot of you know Brené Brown. Understanding the difference between healthy striving and perfectionism is critical to laying down the shield and picking up your life. And healthy striving is self-focused, how I improve. Perfectionism is other focus. What will they think? And in her case, she's concerned a lot about what other people think about her. So how we can manage that? We notice about fixed mindset, we notice about perfectionism. This is what we call the growth model, which is from Sir John Whitmore. He's one of the executive coach. And if you look at him, he has he had wrote books. So G is your goal, like what do you want to achieve? R is reality. Again, Brené Brown said, she liked the TFT, terrible first time. It's just for you to normalize it. Oh, this is exactly how new is supposed to feel. You just started. And this uncomfortable feeling is not going to last. And you cannot get it now. Doesn't mean that you suck at everything. Okay. So where are you in terms of reality? And then O is options. What are your options? What are obstacles? And W, what makes sense, or what are you going to do? What action will you take? So let's look at that as this case. So we let them define their own success. What does success in procedure look like during residency? This is your first time, second time, third time you did. But for the whole 3 years, what does success look like to you? And what is true here? What is your options? Just let's imagine, it's a year from now and you accomplish your goal. What steps have you taken to achieve it? You challenge any of the beliefs that not serving their success. Why do you think asking for help meaning you incompetence? Challenge them. Way forward, W or will, what makes sense or feel right to do. And we can also use these to kind of manage our to-do list. Since a lot of us, I know we struggle with our own expectation, we can set our goal like, what can I reasonably get it done today for your goal? And what is reality? We can go through that, just use the growth model. So during the coaching, a lot of time all the time we ask empower questions. With all of us, we ask questions all the time, all day long. Some questions may actually being judgmental to ourselves, but we can ask questions to empower, and coach can ask questions to empower coachee. What else is true about this? How can I get through this, right? It's the future focus. How is this happening for me instead of to me? And why is that? Because it already happened. You can't change anything about it. What are you making that mean to you? And how would you know if you're doing it right? What can I learn from this? And what am I grateful for? This is some of the example of empower questions. I talk a lot about coaching, how we use it in physician well-being. Of course, there are some limiting factors to implement a coaching program. If I'm not talking about resources, then I'm sure people will be like, well, how are you going to do it, right? So resources, very important. However, you have to think about the return of investment or return of value that you receive from having coaching program. Cleveland Clinic Institute, a peer-based coaching and mentoring program for physicians and scientists, official estimate they have saved 133 million in 2020 from physician retention alone. So if you want to invest in coaching program, and this is maybe could be the return of investment for you or return of value. And professional coaches, I just make it clear that you need certified coach. The group that working with us, they use the group coaching because one-on-one you may need a lot of coach, but if you use group coaching, that could be another option. It's a little bit difficult to train or find someone because it comes with price as well to hire a coach. You can train your faculty in the program to serve as a coach, do some peer coaching, just have to think about some confidential because we all coach always treat coachee or people that we coach as just like we treat our patient. We keep things confidential, but sometimes it might be hard when you work in the same institution and people that want a coachee might feel uncomfortable to share a story. That could be one thing as like limiting factors as well. And we need more standardized procedure, like how much coaching will be effective. This is all need like research. Set up your goal of the coach, like what do you want to get out from here? Who's going to be stakeholder? And we have to evaluate the program, like what tools are you going to measure, how you're going to use that results to make it even more better. So to summary of main point, it is vital to identify the needs and potential solutions both at the individual and system level to help decrease burnout and promote professional well-being. I think we all kind of know that, yeah, we need a lot of other things together. We can't just choose one thing and say, this is going to fix every problem that we have. Coaching is another option, I would say. It's new, growing, and emerging in medical education. The benefits of coaching are promising for burnout and physician well-being, but further research still needed to optimize the effectiveness of this intervention. You might be wondering what's going on. Back to the case. Middle age or mid-career. Middle age is, yes, it's me sitting right here. So what happened to me after coaching? I got a chance to learn about coaching program. I applied for an APD position. I completed the coaching certification. I submitted the application for an award. I did not receive it, but I learned so much throughout that process about myself. I created imposter syndrome and coaching workshops to support learners. I did workshop in Thailand, only have 10 people sitting there, but I think it's a good start. I'm working on research projects. When in the past, I label myself, I'm not a research person, but I'm motivating. I'm willing to learn. And last but not least, I'm being here with everyone today. Public speaking is something that I'm struggling for my whole life, to be honest, but I'm so proud to be here and very honored. Well, you say impossible. All I hear is impossible. That's from Ted Lasso. I will end my talk right here. From Albert Einstein. The world as we have created, it is a process of our thinking. It cannot be changed without changing our thinking. If you have any questions and comments, you can also email me directly. If you want to scan this QR code and want to get coached, that is totally fine. I would love to hear that from you. And this is all my reference. If you have any questions from the audience, and okay, so thank you for information there. There's a question here. Is the female trainee coaching program ongoing? Is it offering through GME? They did during the randomized control trial. Is a free program that you can register. Right now, they already finished the study, so it's not going on anymore, but you can email me if you want to know more information. If I hear anything back, I'm still working with them. And if you have any feedback, I would love to hear so I can improve on my talk as well. Thank you everyone again.
All right, any more questions or comments before we go? No. All right, well, thank you everyone for joining us, and thank you, Dr. Kornsawad, for your presentation. And we'll do this again next week.
Bye, thank you everyone.